Good morning, good afternoon, and good evening, wherever you are, and welcome to this new TechNet webinar on healthcare waste management with a focus on the immunization program. Today, we're happy to welcome Dr. Karan Sagar from Gavi and Dr. Adama Sawadogo from UNICEF and Amos Chweya and Wendy Prosser from JSI. During this presentation, you can submit your questions in the Q&A field or alternatively in the chat box. This webinar is recorded and will be made available on the TechNet platform at www.technet-21.org. I will also send every participant the links to the video as well as the presentation. Karan, the floor is yours.
Thank you so much, Patrick. I would really like to welcome everyone who has taken time out from their busy schedules to attend this webinar on healthcare waste management and immunization programs. And this is an important topic for us, and especially in the immunization programs, as immunization programs reach probably the highest numbers of people through any public health programs. And as a consequence of that, we are also generating a large amount of waste materials. And these waste materials are potentially are of course posing significant public health risk as well as a risk to the environment, because some of them are toxic, some of them are infectious or hazardous. So it really becomes very, very important that this waste which is generated due to the immunization or in the immunization programs is disposed of safely, and the countries have the ability to have robust healthcare waste management plans and operational aspects in place to manage this waste. Gavi has been supporting a large number of countries, as you know, in the immunization programs, and one of the important aspects that we support is through the health system strengthening grants. And what we have seen in the past years is that there was a paucity of guidance around how the country should plan for immunization waste management and put that as a robust business case through their health system strengthening grants or other grants that they get through Gavi or other donors, or even their own domestic investments. And hence, this was a felt need that we should provide some kind of guidance to the program managers in countries so that they can prepare and plan for proper healthcare waste management. And the tools that will be presented today have been developed in coordination with the number of partners, including UNICEF, WHO, JSI, and others. And I hope that these will be used by the country program managers as they plan out the investments in healthcare waste management and immunization waste management in particular. Alexander, over to you. Thank you so much.
And so we'll start the discussion today and the presentation on this guidance document. Amos?
Thank you, Wendy, and thank you, Karan, for the introductions. We'll walk you through the guidance document, and then later we can have discussions. Next slide, please. Yeah, we we are going to talk you through an overview of healthcare waste management policy and practice, which is contained in the guidance. We'll also take you through a healthcare waste management maturity model to assist countries and partners in strategic assessment to identify planned activities for improvement. And we shall also show you examples of available tools and procedures for best and innovative practices and promising technologies for improved healthcare waste management. And finally, we shall share with you recommendations for countries when preparing for applications for resource investments. The document starts with an overview of healthcare waste management policy and practice. Next slide, please. And it talks about the steps of effective waste management practices, and of course, the areas that require attention. As we know, waste has to go through several steps from the point of generation to the point of disposal. What comes first is trying to minimize waste. You don't have to produce. If you can minimize the waste that is being produced, the better. But some of the waste has to be produced. And therefore, the next stage will be when you generate waste, you need to segregate it. You need to have a waste segregation into various waste categories that will help you in treatment and disposal. Some waste is not infectious, some waste is infectious, some waste needs to be treated with caution, and some of the waste does not need to be treated with caution. Therefore, there's need to segregate this waste to its categories. Yeah, and in most cases, we use color-coded bags or bins, and then the waste is stored for a while before it's collected and transported to for treatment and disposal. One of the areas we find a weakness in is the area of treating and disposing waste. We find that we are using very outdated, obsolete technologies. There is a lot of pit burning of waste, be it infectious or non-infectious. We see a lot of low temperature incineration in most places, and therefore there is need for us to replace some of these technologies so that we can have environment friendly incineration or waste treatment and disposal. Next. The document also talks about the waste that is generated through immunization activities. And that is actually the main thing of this document. It's a guidance on immunization waste. And we have all types of waste that is produced here. We have hazardous waste. We have infectious waste. We have general waste also. The document goes further and tells you what to do with opened and expired vaccine vials. How do you segregate it? How do you store it? How do you transport it? And how do you treat and dispose it? It also tells you how to handle infectious waste coming from the sharps waste, how to segregate it, treat it until at the point when you treat and dispose it. It also goes further and gives you information on how to handle general wastes coming from the wrappings of syringes and needles. And also one area that maybe we have not given a lot of attention to is the way we also handle waste coming from the packs that we use to transport vaccines, the ice packs, gel packs. How do we handle that and how do we dispose it? Next, please. It also tells us some of the common barriers and challenges to healthcare waste management, which are common to most of us, and mostly we have constrained financial resources, complicated management with new equipment practices. We have obsolete technologies, equipment and practices. Supportive supervision is lacking, just to mention a few. So it gives you some of the challenges that are being seen as waste is being managed in various countries. Next, please. So for us to be able to know where we are with the way we handle our waste management, we need to strategically carry out an assessment of our healthcare waste management system. And the document tells us that we shall be using a maturity model to assess ourselves. And while defining our healthcare waste management system, healthcare waste management system must be considered from a system perspective and use of broad approach to leverage resources, technologies, and capacity across ministries and governments and titles involved in waste management. And the three main areas here, which we must define while assessing our waste, is we need to identify the people, we need to identify the processes, and we need to identify the technologies. Next, please. The 6 areas that the maturity model has to assess. We have to assess these areas to know where a system, a country, a region is as far as healthcare waste management is concerned. We talked about people. In people, we'll assess the awareness of healthcare, the risk of healthcare waste management. Are they trained? Do they carry out supportive supervision? Are they adhering and compliant to the healthcare waste management systems? That's one area. In the people, we'll assess 2 areas. In the processes, we also assess whether we have national policies. Are they been revised? Are they updated? Do we have strategic plans? Are there budgets? Are there plans? And is there practical guidance at that level? And then in technology, of course, we look at technology and equipment availability and use. Again, what equipments are available? Are they being used? How are they being used? Yeah. Next, please. Now, this is the maturity model itself. It will assess you and put you in a given level. So we have levels from level 1 to level 5, level 1 being the weakest and the level 5 being the strongest. It is really self-explanatory. If you have to assess one area, you'll pick the area and see where are you. You look at, are you in level 1? Level 1, to be in level 1, it's explained what it means for you to be in level 1. Level 2 the same, level 3 the same, level 4 the same. You might find yourself, you are stronger in some areas and weaker in some areas. So, I mean, this will really give you the general situation of where you are as far as safe healthcare waste management is concerned. And here we strongly recommend that whenever you are trying to plan for your healthcare waste management or plan to put out proposals to Gavi and other partners, please, it's good to use this maturity model so that it puts you where you are, then you can plan to move to the next level. Next, please. And this assessment tool will give you a ranking. So for all those 6 areas, you'll rank yourself. Now, the process has to be participated. You don't do it alone. You get all stakeholders involved in healthcare waste management and beyond immunization, because healthcare waste management is just, there is more other areas in public health that produce waste, in hospital waste that also will use the same equipment for treatment. So it's important that this becomes a participatory process with key stakeholders, those involved in healthcare waste management. And of course, this will be guided by the assessments which have been done before, if there are reports, and the understanding the context of the country that you are in. So using this tool, you can rank yourself and find out where you are. There are 6 areas, and you'll score each area, and then at the end of the day, you are able to find out whether which level you are in. Are you in level 3, 4, 5, 1? Then from there, you can start planning on how you can move towards the next level, and so on and so forth. Next, please. Now, to remember here is that the true outcome of the maturity model assessment is not to identify what level your system resides on, but rather to draft a preliminary list of realistic steps that you can then implement to improve your current healthcare waste management system. we have examples of tools that can help you identify your gaps, identify operational level gaps, opportunities, and scalable innovations. Next, please. Now, the tool is also available in the guidance, and use the assessment tool to identify high-level gaps and potential opportunities. This tool has questions to facilitate stakeholder engagement in planning for healthcare waste management. And as I mentioned earlier, there's the review of recent assessments. You can look at estimating waste quantities across all health areas. Landscape of private and sector companies involved in waste management, financial resource and opportunities that for the investment. And really this tool will also build on the maturity model and the system ranking that we have talked about. Next, please. Yeah, so this, the opportunities, tools, and innovations are described to help identify where and how to fill the gaps. There's a list of very many tools, 20 training modules, planning tools, guidance, technology guides, innovations, and best practices identified with the links to further information for details. So as you plan, you can make reference to these tools to help you come out with a better plan. Yeah, and on top of the tools that are available, we have now a new tool that has been developed by UNICEF, which will also be helping us come up with better plans on how to manage our healthcare waste management. The name of the tool is Appropriate Disposal of Immunization Waste Platform. Next, please. So we also, we recommend, there are some recommendations for the countries when making applications for resource investment. Now, countries are encouraged to develop healthcare waste management interventions that support or provide a catalyst for a system approach. This may include, well, implementing measures that address a single component of the system, or those that address many components of the system. Recommended steps for designing and implementing healthcare waste management. Of course, you have to conduct a high-level strategic assessment, as we mentioned, and you can use the maturity model that we have shared, and it's available in the guidance document. If you are making proposals to Gavi and other investors, plan for immediate actions to address the common barriers. There are those barriers that that are low-lying. You address them first as you move to the next. Yeah, and identify and engage stakeholders broader than immunization. The stakeholders may not be on the immunization. There'll be Ministry of Education, there'll be Ministry of Finance, and many others. Please engage as many stakeholders and those who are key as possible. Consider the preferred technology of equipment. What would you want to use as a technology, especially for treatment of your waste and disposal? Then you need to identify opportunities for further forms of investment and the collaboration across sectors. As of that, then we can now ask Adama to bring in the UNICEF tool that will also be very helpful in this exercise. Over to you.
Thank you so much, Karen. Thank you so much, Wendy and Amos, for introducing this topic on this webinar. First of all, I think Karen rightly said that immunization is one of the interventions that's really critical and also efficient, but at the same time that we have some coverage that is increasing and also some new vaccine coming in the vaccination schedule, immunization is also releasing a lot of waste. And actually, one of the challenges is that we need to make sure that the after immunization delivery is also taken care safely. So having that on mind, we have tried to come with a tool. I like to call him a platform, and I will say why we call it a platform. The objective is actually how to practically guide the people in the field to really manage appropriately the immunization waste that is generated, and it consists of, linking where the immunization waste is generated to a site where the immunization waste can be adequately disposed. This is fortunate because we can actually collect and transport safely the immunization delivery waste, mainly syringes and vials. So using this opportunity, this tool tried to come with how to do it in the field. And then the concept of the appropriate disposal of immunization waste platform is based on 4 key principles. The first principle is the adequate clustering of health facilities around selected treatment and disposal sites. How do we link the health facility to places where the waste can be appropriately disposed of? That's one thing. Second thing, the good and practical combination of acceptable treatment. Acceptable treatment means that there are things that are not accepted in country policies or in global policies. We should avoid this one if they are not allowed by the policy. But what we have in the context that match the policy, how do we combine them in a way that we have any facility that generated waste, we have a place where this can be appropriately disposed of and available locally. Third thing is the accountability. It's not like just giving some instruction to people. People need to be committed, to be involved, because they have responsibility and they have clear responsibility assigned to them at any step of the process so that they can be redevable on that. And then the fourth thing is we should not wait to have the most, updated or the most innovative process of equipment to start taking care safely of our waste. We have to start now, and then further improvement can come later. Just to illustrate the clustering process, you have here some, cluster that just to show, you see the facilities that have generated their waste. There is a way to collect them and then bring them to a sub-district or a district or a regional hospital in a way that the collection can bring the safety boxes together somewhere, and then, for example, here, they can be transferred to a disposal site, be it a regional hospital, a district hospital, or even outside the health system to make sure that the disposal is safely done. Among the treatment option that we consider generally, we take into consideration what can be, for example, new things that are really properly used for treatment, including autoclaving followed by recycling, or autoclaving followed by encapsulation, or we can also use non-incineration method, like here we have, for example, melting solar melters. We can also use encapsulation, meaning that we have the possibility to not burn the waste, or use controlled landfilling. All these options exist, but also we have incineration at high temperature with pollution control, incineration at medium temperature without pollution control, but also some one-time event solution, like we are doing, for example, for polio. We have, for example, some using, for example, heating to really take care of the waste. In one event, they are not recommended for routine utilization. All these things exist and can be used in a combination that we take care safely of our waste. We'll see how to do that. So, but before we see an example of how to do that, I want to raise your attention to when you have a situation in the field, we generally have to involve people. And this is actually what this platform is willing to do. The platform is not a ready-made solution, meaning that one fit all. It's your solution that you need to design in your own context. and we will see how to do that. And then one of the requirement is to involve those who are part of the exercise of planning on how to take care of the waste. You have to involve them, not just designing your alone and taking and asking people to follow. No, you have to really make the design together. For this to be, you need to have a common objective, a common understanding of the waste need to be disposed, and then you have a joint planning. I insist you should have a joint planning, and then the tool will be used to guide you in this joint planning. Because at the end of the day, you have to complement each other beyond your difference. When we say that this facility should bring the boxes or safety boxes to the other facility, this means that you are complementing each other. So this spirit need to be there, and then the responsibility and accountability to succeed as a team should also be there, because you agreed on something together and you agreed in a way that it is the implementation. Let's go then for an example. An example, for example, we are going to use 5 steps to manage the waste generated in a district called Adiwa district. The first thing to do is to understand that we need to define our context. To define the context, you have to define actually 5 types of information that's needed. The first information that we need is who is part of the planning exercise. We list all the facilities. Here I listed, for example, 15 facilities with their population. And then this is the first thing to do. Who will be part of the exercise? Now, the second thing is, among those who are part of the exercise, what do we have in each of the facility? What type of treatment and disposal option do we have? For example, here you see in this column G that existing equipment. Only health facility 1 has something that is called treatment facility that can incinerate between 800 Celsius and 1,100 Celsius without pollution control. This is what they have. But when we look at the others, they don't have anything. Okay, fine. This is fine. This is the situation. But the next column we have, okay, what do we plan during the year, for example? What do we plan to have as disposal, treatment and disposal option in all these facilities? One has something that is planned. It's health facility number 8. It will plan to put in place an incineration facility beyond 1,100 Celsius without pollution control. Fine. This is done. We know then what is the context for this facility. Now, what is the program schedule with the vaccine in the program for the routine API? We also list all of them regarding the vaccine, the number of doses, the coverage, whatever. So this is one thing that also is part of the context. Then, do we have to plan for an immunization, a supplemental immunization activity, like a campaign? Okay, here we have listed measles campaign. We can have, all the vaccines that are in API that can be used for campaign. We can, do what we can select what we want, and then put the information here. Do we have also a mass campaign with non-API vaccine? For example, we are in COVID context. We can select to have, we'll have a campaign with COVID. Okay, we select COVID and we provide the information on the COVID vaccine. Here we have just put information like this, not because we don't have any clue of the vaccine on COVID, but this is an example just to show. Then we have also to come with some information related to transportation, because we say that the immunization waste can be transported. Okay, do we have transportation information like motorbike or 2 or 3 wheels cycles, or the supervisory vehicle, like a kind of pickup, a van, a truck, whatever? We put the information, general information related to this transformation means that are in our health facility context. But last but not the least is, what do you have? Remember that we have the health facility that have been, that are part of the exercise that we have listed with what they have as option for treatment. But we also have out of the health system or in the health system, we may have some settings that are near the facilities or at some distance of the facilities that can help. Of course, we have to have an agreement with them at some point, but they are part of the consideration. We may have the regional hospital or the district medical office that will be used like a temporary, interim temporary storage, facility. The municipality, maybe they have something that can help us, or a factory that is here or not far that can also help. We list all of them with the options that are there. Then, if we finish that, we have defined the context. So this needs to be done as a group, as I told, we have defined the context. After defining the context, we go to the second step. You see, in this second step, we have our facilities that were listed to be part of the exercise that are here with their population. But we have not, we can select what do we want to do. Is it to plan routine immunization, waste management? Okay, we go first with routine immunization. We have for all the vaccine in the program, it comes with the AD syringes, if this is the case, the vial, the dilution syringes. Where we have where we don't have dilution syringes, it's skip, and then we have all the things that are defined here. And then at the end, we can have the total number of syringes and vials that are here. So we can quantify what we are generating with for each health facility. Having said that, if we know what is our context and we know what we are generating, okay, let's go for the first step. The first step is, okay, how are you going to cluster these facilities to where we have the option for treatment? Here, we have all the facilities that are here again, with the number of safety boxes that are here, and the number of vials that are here. And also you have in column F, what we define that treatment option that is existing in these facilities. And remember that health facility A did not have something, but they plan for something. This is new equipment. So he reminds us that at this point, this equipment does not exist, but it's already planned, and we need to consider that this is a new investment. And then we also have at the bottom, because the list of facility can be high, at the bottom we have the other settings that are not part of the, not necessarily part of the health system, but they also can be like the regional hospital that is also not part of the facility that are generating the waste, but they have something that can help treat and dispose our waste as far as we have an agreement with them. We have the district, we have the municipality, we have a factory. We can have more or less. So having said that, let's go now for how do we discuss together and define the clustering. For example, health facility 1, the waste from health facility 1, how do you cluster it? Of course, health facility 1, as far as the equipment that is there is functional, we should not be moving health facility 1 safety boxes elsewhere. So we select health facility 1 as the point where the waste from the health facility 1 will be treated and disposed of. So this is health facility 1. For the others, we can select whatever we want, but for the sake of the exercise, I put all of them in the district medical office as they don't have anything. They are storing there, awaiting the treatment later. So health facility 2, health facility 3, those who don't have anything, they are bring the waste will the safety boxes and the vial will be brought to the district medical office for interim storage. Remember, that is what we have defined here. Let me come back. You can see that the district on column L, the district medical office has interim storage facility. So when we come here, we have health facility 1, 2, 3, and go to the medical office. Health facility 8 has something that was planned, that is planned. Okay, we consider that by the time we are using, we'll implement, they will have it functional. So we put health facility 8 will remain on health facility 8. And then health facility 8 will not be alone. We have health facility 10 that will also bring to health facility 8 here. And also L facility 15 is also bringing the boxes to L facility 8. And then those who are storing at the district medical store, later, these boxes will be brought to the regional hospital. This is what is, and the distance are also here. So when we have discussed together, we can discuss and say, oh no, I don't think this, I don't think, because there are some criteria that are provided to select a reference site. And they are here that you can consult later, they are here. So coming back to so we have done the discussion and we agreed on this clustering. I will come later to this part. We are here and column H and I for the routine discussion. And we find a way that this is the way we'll go. Then after doing that, we go back to the fourth step. This is to structure, how do we structure the collection and the transport and treatment? So the collection will be done around, let's say, around a reference site. So we have to select a reference site. A reference site, for example, we say that L facility 1 will be a reference site. So those who will be gathering around L facility 1, they are listed here. They come here automatically. They are coming here. It's L facility 1, L facility 5, L facility 12. And the number of boxes and vials that they will come with to the health facility 1 treatment site. So having said that, we come to indicate how do we collect that? Is it a transportation that will be done directly to the health facility 1, this is the site for treatment, or it will be done via a circuit, meaning that we can go from L facility 5 to L facility 12 before going to L facility 1. This is selected here. Here I selected direct transportation, meaning health facility 1, go directly to health facility 1. But I can say, okay, I can also say no. They will collect in a loop, kind of loop. The two facilities, L facility 1 and L facility 2 will be in the same loop, meaning that we'll collect from 5, go to 12, and then come now to L facility 1. Of course, L facility 1, there is no transportation. It's actually the same place. One L facility 1 has something. Then what is the collection frequency? Okay, here I selected monthly. Monthly, this will be done. And then who will do that? Who will be responsible? Okay, here you can see I selected lump outsourcing. It was for the health facility 1, it will be transported directly via maybe a wheelbarrow, no motorized transportation. But for L facility 5 and L facility 12 that are collecting to bring to L facility 1, this will be outsourcing. And this will be, who will be responsible? We select the responsible here. Here it will be the health facility for health facility 1 because it's within the health facility. But for the two others, it will be a private company. One private company 1, one private company 2. And then there are costs for that. For example, $100 or $150. So we discuss and we put all this information. Now, when we finish to put this information, of course, we have to take care of what the health facility 1 has, the capacity for treatment. Here, I put 50. But you see, because I put the number of syringes and vial are already listed here for the routine, it's for the whole year. It said that the minimum treatment that will be required at the health facility 1 will be 30 kilo per day. Now, if we don't have this, for example, we don't have 30, we have 20. This is what we have. So we have a message saying as this is not possible because you cannot extend the year. So you cannot dispose all the waste that will come to this site during the year with this capacity, unless you discuss again how to cluster and reduce the number of clustering, or you find a way to increase the capacity of treatment, or you review the number of health facilities that are clustered, because you cannot extend the duration because it's already the year. So for the sake of saying, let's put that we have 50 like I put, everything is okay, the message is there. So it means that if we collect monthly, as we discussed here and agreed, 1,320 kilo will come every month to this site. And with this capacity 50 per day, we'll have 26 days. So with 26 days, you are already beyond you are already almost, it's like monthly, it's okay. You just have 4 days for the capacity for the treatment site to be able to maintain or to rest before the new collection cycle. So you have 4 days remaining, because it will take 26 days, but you have 40 days because you are collecting monthly. You have 4 days to maintain your equipment or to before the new collection. So having said that, we have agreed that this will be the point for the health facility one. Let's go for the other site. It is actually the district. Let's select the district. And then you have here the district medical store. When we select the district medical store, again, all the facilities that are clustered to the medical store for interim storage are listed here. There are many, and with the quantity. And the same thing is done. And then we also go for the health facility 8 that was identified as a collection, a reference site. And also you have all the facility connected to this are collected. And we have the same discussion in terms of how to collect, the frequency of collection, who will collect, what is the transportation mean, and what are the costs. You discuss and you put everything, and who should be the responsible. All these things are identified. But the health facility are collecting to store in the district, but the district will later on come to the regional hospital, and this is here the district medical store will bring to the hospital direct transportation, because we say that it will transport them. So it will be done bi-weekly, and these are the transportation. A truck will be used, and the district will be responsible for the transportation, and this is the cost for the transportation. Having said that, we have finished with all the agreement in terms of where we store, where we treat and dispose the thing. But let's now go and see the, because we may have many reference sites, but at the end, you can see these 3 health facility 1 is here, the medical store, district medical store, and also the health facility 8 and the regional hospital. So for all of them, there are costs that we need to bring regarding the work, the functionality of the disposal site. How do we maintain it? This has a cost. What is the salary of the one operating this equipment? This has a salary. There are additional equipment, like for example, the equipment, protective equipment. So all these costs are listed here, and at the end we can see for each scenario, meaning for those who come into health facility 1, if we see the unit cost of a syringe, it comes to 0.01 USD in terms of cost, meaning 1 cent. In this scenario of health facility 1, it will come to 1 cent. The other one also are 1 cent, 1 cent. Okay, and remember that the cost of there was one new equipment, and because we put that the new equipment to be installed, it costs for this new equipment 50,000. It's reflected here. So you have new investment is 50,000 because this is what it costs. But the implementation of this will be for each facility will be 1 cent multiplied by the number of syringes that is or pro rata syringes that are produced in each of the facility, and here are the cost for each facility. You see the facilities, and also the facilities are here, and then the cost of the total syringes produced by this facility, pro rata of what is the cost for each syringe managed in this specific cluster. So this is then the total implementation cost. This is around 80,000 for this district, $80,000 for the district to manage properly. You can also see, oh, this is costly, and then we go back. Now at the end, when we have agreed on all these things, it's a recap in a table. The table recap what we have agreed on for each health facility. Health facility 1, this is the cost that we have. because it's in the cluster that the unit syringe is, for example, 1 cent, times the number of syringes of health facility 1, it will cost for health facility 1 this. Because you have to take responsibility of what you are producing. So the reference site for health facility 1 will be health facility 1. Transportation circuit, there is no transportation circuit because it's within the health facility 1. The transport will be done monthly, will be done with a non-motorized transport like a wheelbarrow, and who is responsible? The health facility. We take health facility 2. Health facility 2 will, the reference site will be to bring the waste to the district medical office, and it will be in a loop with other facilities, and will be done bi-weekly, and it's outsourced, and this is, for example, the company that will take care of that. So for all the facility, the coordination body, that's here the district, will have this table reflecting what has been agreed. But at the end, it's not just for the district to have something that is, recap, but to say, okay, health facility 1, because you are bringing the waste from health facility 1 go to health facility. This is what we call scenario 1. So scenario 1 is, you see, health facility 1 here. This is the health facility, monthly, non-motorized transport. Who is responsible for the transportation is the health facility himself. Where do we go with the waste? To health facility 1. What do we have as treatment option in health facility 1? This is an incineration facility. And then the task, this is the itinerary, the task, what will be done at each level, and then how to follow that, to monitor that. We have the record that should be done at this, the generating place, the transportation, and the disposal site will also fill this. And we have, this should be given to health facility 1. This is what health facility 1 has to do. And then the district has the table, but the health facility has the picture that they have to follow every day or every month. Then when we go back to
Adama, we do want to allow time for questions.
Yes,
so
2 minutes.
finish up. Okay,
Yes.
great.
Thank you. Let's take another example. For example, health facility 7 will go to the medical store bi-weekly. Oh, this is okay, good. This is what we call scenario 3. So this is scenario 3. Scenario 3 is health facility 3, bi-weekly, outsourced, certified company, district office, district medical office, and interim storage. And then last, when we go back to the district, okay, the medical store, sorry, when we go back to the medical store, we see that this is scenario 4. Scenario 4, okay, this will be, okay, this is the interim storage at the medical store, but will be transported to the regional hospital. This is the way, and then this will be done bi-weekly. So just to come out, it's just to say that we come with an agreed way of managing the waste in our district or our region. Then everyone has his own responsibility, and it's easy to monitor because at the end of the day, the health facility will have his picture with his mandate. The district or the region will have the recap of everything, so they can do a follow-up. And this can be for routine, be done for routine. It can be done for campaign, but we don't have time to look at the campaign example. So what I want to finish is, yes, immunization has always received high level of attention, but the practice of after vaccination need also to be taken seriously. And the question is, shouldn't we now think about earmarking at least 1 cent or 2 cents per syringe or vial purchase to contribute to the appropriate disposal? This can be done if countries are organized in the way that we're suggesting, to organize the way they are going in their district or in few representative districts, and come out with a kind of, to really take care of a syringe or a vial in our country. This is what we need at least, or an average cost of 1 syringe should be disposed using this cost. So I will stop here and hand over to Wendy.
Great, thank you so much. And thank you, Amos and Karan, and this really just was hopefully to set the stage and open the conversation and really put waste management back on the radar, that it is a systems approach and not just individually, but it does need to be a system coordinated. We have a few questions in the chat and in the Q&A box. Please add more as they come to. One question was on the availability of the guidance document in French, and it is available in French on the Gavi website. All the documents are. There's also a TechNet topic page specifically for waste management where you can find the Excel file that Adama just presented, as well as other resources and innovations and tools and guidance. There's one question I think Adama and Amos would be able to provide some insight from Olivier. Is the offsite transportation a weak point in the process of healthcare waste management? Who is currently responsible for this part of the process? If it's health workers or district or provincial, and like what's the reality on the ground right now? Adama, do you want to start?
Yes, thank you for this question. Actually, that's what I'm saying about the contextualization. We cannot stop immunization for being done every day we are generating. While we have, what do you have in our context? Of course, we have the policy that should be defined. And in the policy, we should know what is really permitted and what is not. But at the same time, we can see in our context, matching the policy, what transportation is possible. If you have one box of safety box, one safety box, for example, for a health facility in a month, or how do we transport that? If it's well folded and well closed, can we transport that to the district if this is the way we should do every month? Yes. How can we do that? Of course, we have to take some precaution, but this is doable. I don't want to say that this is the transportation mean that need, but everyone knows that if the box is well closed and well folded and there's reduced risk of puncture and thing, we have to take this precaution. And then I think even the supervisory vehicle can take it, or even sometime you can really take it with your motorbike if it's one box. You take it very well in your bike, and then you bring it to the district. Of course, if it's accessible easily. If not, Great. You can see how we can rightly, take care of this box on the site and not moving, because it's risky to go in some ways with one box even.
Great. Amos, do you have any insight into the current weakness? Is the transport a weak point in the system?
And again, it depends on what districts or regions have agreed on how they're going to manage their waste. Practically, we see a lot of scheduled field safety box collection from facilities on weekly or bi-weekly basis to a treatment site. It works. If it's well planned, it works, and I don't think we know sometimes the amount generated is too small, but where you have organized a form of collection or transportation to the treatment site, it works, and it works well, because there's no point of a facility trying to treat or manage its waste on those pits of burning pits and so on. So I think collection and offsite is something that we can look into.
Great.
Maybe let's say that we are talking about immunization waste here, delivery waste here. We are not talking about the other, that should be clear also for everybody.
Great, and that leads to another question. What about the treatment of PPE and other similar waste likely to be generated in the process? That also needs to be planned. Can you provide guidance on how you plan for that type of waste and how it fits in together with immunization waste? Any experience with that, Adama?
Yes, we have actually an informal group with other partners that have regular meetings related to the COVID context. And we gathered, the group gathers a lot of experience on how to treat COVID-related waste. And I'm happy to share what we have in this regard. Yeah.
Great, thank you. Another question is on the assessment tool. Is it also important to include incineration capacity of the available incinerators to ensure that waste will be coming at a rate at which it's disposed? Is that captured in the tool?
That's
Adama?
exactly what I'm showing. If we have time and we want to go through some details, you will see that this tool is really matching the reality on the field. And let me here open the floor and really thanks many people in countries in the field that contributed to this tool to make it really a field-related tool with the different experiences. Yes, to your question, this is taken and if it's not possible, you have to consider either you recluster your facility to this, reduce the cluster that come to this specific place where the capacity is limited, or you extend for example, if you are in a campaign, you say, we want the waste from the campaign to be treated and disposed in 14 days. If with the capacity that it will show that your 14 days is not realistic, you have to expand it to make sure that the capacity is able to take it, or you reduce the number of facilities that are clustered to this specific place.
Great, thank you. We have a question on the budgeting from Craig. What are the steps taken to budget for destroyal needs that often seem to be a limiting factor?
May I?
Yes, please.
Yeah, this is a good question, because at the end of the day, it comes to budget. That's why with what I have presented, maybe the time was not sufficient, but you will see that at the end of the day, you have to discuss, do we have this budget? If we don't have, let's reconsider another way of clustering and provide, because everything, be it the collection or the transportation or the treatment and disposal, you need some budget, because at any point you have to make sure that everything functions. That's why my cry was at the end, when we are planning to have some support to introduce vaccine or to do, how can we earmark something that will go for at least helping people to really take advantage of the planning that should be part of their new behavior in a district. Maybe one time is like at the beginning of the year, you plan this, and every facility has its way to do, because you agreed on that. You have the budget, every facility know what will be the budget pro rata of what I am producing, and can reach out even individually to support. A specific partner can support one facility and say, okay, I will take care of what this facility is it's requested to. But everyone has to put something on the table to make the entire system that is defined functional. So I think the budget is key to really have that. That's why maybe if Gavi can also support this aspect, it may help countries to have a new behavior.
Great, and we are running out of time. The other questions, the remaining questions, we will add to the TechNet discussion. A couple of interesting questions that came up is outsourcing, and yes, outsourcing to private sector to do waste management is definitely a possibility, and it also usually brings return on investment. And then the other question that I would just want to tap into is that immunization waste is about 10% of all medical waste, as this question points out, and it is important that it's part of a systematic approach, that immunization you can plan your waste, but it must be coordinated with the larger system to get return on investment for any kind of private sector treatment and disposal sites, or just the broader view of waste management. So as I mentioned, we'll do a summary of the questions on the TechNet discussion site. Thank you very much for your participation in the questions and the interest. Alex, I don't know if you have any final words.
No, thank you very much to everybody who joined us today. I'm going to send everyone who registered to this webinar links to the presentation, the recording of this video, also the links to the topics page, where you have the links to all the documents and everything that will be useful to you, the tools and more. If you have further questions, it will be possible to ask Wendy or anyone else on the TechNet forum. Also, it will be possible to contact me by replying to the email that I'm going to send to you tomorrow or Monday, the latest. Thank you, everyone. Does anyone want to add something?
No, thanks again, everyone, for your participation and interest.
That's great.
Yeah,
Thank you. And have a great day or evening wherever you are. Bye-bye.
Bye.